Okay, good evening, everyone, and welcome you all to this Millionaire Mindset Practice program, which every day we are doing it. Okay, in today's session, we are discussing one of the important tasks which we have given in our financial wealth checkup. If you have not yet done your financial wealth checkup, go to the description box and click the link given there and do it your financial health checkup. It will give you a score where you can understand where are you standing in your financial wellness list. Okay, now in that one question is, do you covered you and your family adequately for your health insurance? Okay, now why health insurance is very, very important? Because if you don't have health insurance, there may be a chances that you are spending your hard-earned money which you have saved from so many years, and there is any uncertainties or there is any medical emergency, you may have to spend that money for your medical expenses for the hospitals and all. Okay, now according to the data, in India, 5.8 million people die from non-communicable diseases every year. What are the non-communicable diseases? It may be cancer, it may be like heart problem. There are severe problems which is not transferring from one person to another. That is called as a non-communicable diseases. Now, according to 55% of those people are dying from cancer, and 43% people are dying from heart disease. It is alarming, right? Okay, even India is becoming a diabetic city, diabetic country, because there are a lot of people at the young age itself is going to diabetic, and they are suffered from diabetic, BP and all. It is nowadays common because of your maybe work pressure and because of the lifestyle which we are following nowadays. Okay, we don't have time to go for a gym or like walk, all those things and all. It is very difficult to do that one. Even the food we are doing, like ours is fast life. We are taking unhealthy food, and we are like already attached to that. Okay, so now what is the funda today here we are discussing? If you are not able to maintain your lifestyle, or if you are not able to maintain a good health, it is very important that you must have a health insurance. Not only, even if you are maintaining a good health, there are chances that people, even if you are a good driver, there may be another person in India, especially from anywhere, however the people, if they want, they will come and hit. Okay, even if you are a good driver, there may be, because of somebody else, the person can met with an accident. And you know that when the person is meeting with an accident, there may be a death, or there may be a total disability, or there may be a partial disability, or maybe there is a temporary disability, and person may be hospitalized anytime. So to understand this one, so everyone should have a health insurance. Okay, to cover from all these medical emergencies, everyone should have a health insurance. Now, when you have a health insurance, how it is going to helpful for you? The first and foremost thing, okay, it is a protection from your medical expenses. It may be hospitalization, it may be surgeries, it may be medication, it may be a diagnostic test, it may be healthcare services. Everything you are going to cover in your medical expenses. Okay, like medical health insurance, whatever the health insurance you are taking. Second important thing, it will help you to access quality healthcare. I wanted to give one example here. Like recently, from our own community, there was one lady like who had a diabetic, and like they didn't had a health insurance. That's why they delayed the treatment, because they didn't had money also. And one fine day it has happened so that she has to do a liver transplant. Other than that, there is no chances. And when you see their bank account, there was nothing left in their bank account. So later, the community people came together. They helped that lady, and all are generous. They helped. And even though that money was not sufficient, do you know how much money she spent? 33 lakh rupees for the liver transplant that her own daughter gave the liver. So that's why it was so successful, and like with the less cost it happened. You just imagine if somebody else donor, we would have found out somebody else. Maybe it may take some longer time also. Maybe it may take more money also. So that's why finally, like from CSR funds and all, they collected money, and now she wanted to have a health insurance. Unfortunately, no company is giving health insurance for that disease because it's a already pre-existing disease and it is a major critical illness now. Maybe she can get a coverage for some other things, but not for the liver thing or diabetic related things. Okay. So that is the thing. And so make sure that if you want to have a healthcare, okay, you have a sufficient coverage in your health insurance. And today only I got a call from one of my friend. His son was having like what is that, I think yeah, a dengue. And he said that I admitted my son in Manipal hospital. Why? Because I know that it is not covered in my like health insurance, that much of room rent, but still I want a better quality service. So whenever now the lifestyle is increasing, every person, they want a peaceful life even in hospitals as well. They don't want any like irritations when the person is on bed, like all those things. So they recommend not single standard AC room. At that time, your coverage should be sufficient. Otherwise, only companies are 1% of the sum insured as a room rent. And depend upon room rent, all other costs varies. So make sure that you're not spending anything from your pocket. So make sure that maximum of the things which is covered from your health insurance, make sure that you're taking adequate coverage and sufficient coverage with almost all the things which is covered in the policy. Next, it will help you to go for a preventive care as well as wellness benefit as well. Maybe once in a year, they will get like what you can say that health checkup, free health checkup. Based on the coverage what you have opted, you will get the free health checkup as well. And next important thing is a financial protection for your chronic diseases. Maybe, as I said, like heart disease or like cancer. These are all the things which will take a lot of money. I remember that one of my community member who came 2 years back and he asked for 1 crore coverage for his health insurance. I was shocked. Why you required 1 coverage? Then he told this story that his own aunt, who is from, and like who spent 60 lakh rupees for cancer treatment in Tata Memorial Hospital, and she sold her house. She had a house, she sold her house, and she got a buyer immediately. She could able to afford that. Just imagine a situation. Maybe you may not be having a house at present, or like even the same person told me another story, like his own marine engineer who is one of his friend who sold his house for his daughter's cancer treatment, who was just 10-year-old, and unfortunately they couldn't survive her daughter as well. Now they don't have a house as well, so they are staying in a rented house. These are some of the cases which we may not expect in our life, but we don't know what is the situation. So it is very important that we have to prepare for all those situations. Next thing which is covered in your medical insurance, that is emergency medical services. As I mentioned, accidental cases. Accidental cases are covered from after 24 hours. After your policy is issued, even after 24 hours, the person is meeting with any of the accidental hospitalization will cover. And it is definitely help you to do your long-term cost saving, because maybe you have kept some of the financial goals and you are accumulating money for that financial goals, maybe your children's education, maybe for your children's marriage, or maybe for your own retirement. Unfortunately, if there is any medical conditions, and if you don't have any medical insurance, then definitely you should not think about your goal. You have to remove all those money. So make sure that you will not go to that situation. So there is a saying that even if you are taking like loan and paying like health insurance, it's better, because maybe today you 30,000 loan for your health insurance. If you don't have a health insurance, you may have to take a loan of 4 lakh, 5 lakh, or maybe 10 lakh, or maybe 50 lakh, depend upon the severe condition. I do not wish to anybody to go for that situation. Okay. And ultimately, finally, the important thing is a peace of mind. If you have a health insurance, don't think that, okay, I have many a times, I have more than 500 clients in my community who has taken health insurance from me. And I've seen that every people are not that I am paying my health insurance premium from 10 years, 20 years, but I have not used it. I always say to them, thank God, because you have not used it. What does it mean? Means you are healthy. Nobody wants to get a money back which you have paid for the health insurance, and when you are getting that money only when you are hospitalized. Don't ever imagine that situation. I wish everybody should have a health insurance, but everybody should not use the health insurance. That means you should be healthy always. Don't take it in a wrong way. You should be healthy always, and thank God, and surrender to God and say that I have taken my responsibility by taking this health insurance. Make sure that till end I will be healthy, and maybe my premium, whatever I have paid to the company, may be useful for somebody else when they are in need. Okay. So the next important thing you have to understand here, maybe like there are waiting periods. You have to be very careful when you are taking a health insurance. The first waiting period is like I already given one video about that, but quickly I will go through that. If you have any accidental cases will cover after 24 hours. Apart from accident, all other cases will cover only after 1 month. That is 30 days waiting period is there. Any company you will take, no matter, you will get the same according to IRDA rules. These are the conditions. And apart from that, there are some specified diseases like hernia, knee joint surgery, back pain surgery, sinus problem, thyroid problem, and maybe or some cataract and all. These are the things which is coming under specified diseases. These will cover only after 2 years, that is after 24 months. And there are some cases like pre-existing disease. If you are taking any medication for BP, sugar, cholesterol, or for any other matter, you have to mention that, make sure that you are disclosing that to the company. And these things are considered, or any surgeries which has happened previous to that, previously taking to the insurance, then these things are covered only after 3 or 4 years, or maybe 2 years, depend upon the company which you are opting and depend upon the plan which you are opting. Okay, so nowadays companies are giving, if you are ready to pay some additional premium, companies are covering some of the basic diseases, pre-existing disease, even after 1 month as well. Okay, some major critical illnesses, there is a waiting period, or may not be, company may not cover at all, but they may give the coverage for some other illness and diseases. So it is your duty that when you are paying your money for your health insurance, if you want to buy a peace of mind with that health insurance, make sure that you contact a professional advisors who is helping you to and giving you a comparative analysis about the health insurance, term insurance, whatever the accidental insurance which you're opting. These are the 3 insurance which normally I recommend in my community and in my webinars and all, workshops and all. So make sure that you are having these 3. If your family is dependent upon that, anyway, I will discuss more about term insurance in my next session. Another thing which I forgot to tell you, how much sum insured you have to take. So the first important thing you have to remember, that is like your lifestyle. Okay. Second, which city you are in. Normally, if something happens, where you wanted to go and which hospital you wanted to opt for it. And next important thing, like family members. How many family members are there? And the health issues of your family members depend upon, and your age depend upon these. You have to calculate your sum insured. If you are stuck into that, if you want to get our help, you can contact us, and we will give the contact number as well. So you can contact us, send an email to us, so that we will help you. Our team will help you to analyze your situation and give a right advice and right insurance plan by comparing 2 to 3 other companies, best companies, and give you the right solution. Okay. So this is about like health insurance, why you require health insurance, and what are the things you have to consider before buying a health insurance. Many more things are there which is yet to cover, but because of time constraint, it may not be possible to cover this, but important things which I have covered it. But before taking a decision, make sure that you are understanding all the policy terms and conditions, and then you are taking a health insurance. Okay, and another advice, if you are already having a group insurance from some banks or like your own corporate, make sure that you are having one separate health insurance for you and for your family, because at what time banks may back up, or what time your corporate can kick you off, or like maybe because of some of the reason you may come out from the company and you may not be having the health insurance at that time. And at that time, if you are thinking maybe critical illnesses or because of the situation, you may or get a health insurance from the companies. Don't ever bring that situation in your life. When you are young and healthy, please make sure that you are having a health insurance for you and for your family, so that you can protect your existing wealth, whatever you have created from so many years of your hard work. You maybe have sacrificed a lot of things to accumulate that wealth. Because of this one silly mistakes, which is not having a health insurance at right time, don't ever lose your hard-earned money. Okay, that is my humble request with all of you. If you are not if you are covered, then congratulations. If you are not yet covered, make sure that you are taking one right health insurance at right time and immediately without delaying it. Okay, so this is about today's topic. If you want to get into more topics, like, please subscribe our channel. And if you think that, okay, this is the right information, it has to reach to your family, friends, and all the people, just share it with your social media and groups, this video, so that it will reach to many, many, many people, and they will protect, like you, they will also protect their hard-earned money, their accumulated wealth. Okay, and a very important announcement, tomorrow at 7 p.m. to 9 p.m., 2 hours, we are having our workshop that is related to how to come out from negative beliefs and how to attract abundance by mastering your personal finance. If you are not yet registered, please register. We are giving the link there also, and please be there. It is a free session for 2 hours. I'll try to give my best to make you understand how you can become your own financial planner. Okay, so be there. I'll see you soon tomorrow, and please share this also with your other friends. Tomorrow is a Saturday. You can spend some time for learning something for you, so that you can safeguard your money. Okay.